Thank you so much, Steve. Thank you, everybody, for joining us. Today, the topic is easing your solid phase extraction headaches. I have a handful of slides to get through, so I'm going to go quickly, without speaking quickly, of course. So the first thing, kind of historical background on why we would perform sample prep. First and foremost, we're going to say removing interferences. So the picture here on the far left is kind of, I guess, exemplifying the fact that we are improving our chromatography as well. Also by, sort of removing interferences from chromatography, what I meant to say is that we also are removing interferences that can foul our column, foul our instrument, kind of gunk up on our equipment over time. So, kind of improving the data analysis as well as maintaining instrument cleanliness. In addition to that, sample prep is performed for concentrating analytes. So maybe we are able to perform something like solid phase extraction in order to extend the lifetime of maybe an older system, helping us reach those limits of detection, limits of quantitation, that are increasingly decreasing. That makes sense. And then finally, solvent switching, usually as performed as a function of doing sample prep in general, starting off sometimes with an aqueous-based sample and ending in something that is, an organic solvent, maybe volatile and amenable for GC, or potentially some type of organic solvent that is more amenable for reverse phase chromatography. So these are, in general, the three sort of reasons why you would perform sample prep. And now I will start with kind of the overview of the presentation. We're going to do some math up front just to get everybody kind of squared away. We're going to look at pretreatments and then introduction to solid phase extraction, talking about the chemistry that's involved with that for some of the separation modes. And then we're going to look at what we have historically called method development, so SPE 1, 2, 3, and then looking at a case study specifically for methylphenidate, otherwise known as Ritalin. So the thing that I think is important to do, we need to make sure that everybody's kind of speaking the same language, before we get involved with method development. Calculating absolute recovery is very important to do correctly. What we're showing in this particular slide is that it is important to make a matrix match standard in order to understand, how good your recovery results are. So I know that was the highest responding answer for one of the poll questions. And basically what we're doing here is to assess the performance. Typically you think about calculating recovery as, kind of a relative recovery, right? We're pre-spiking in our internal standard along with our sample so that we can track and make sure that our SPE device is working appropriately. Now, when developing a method on an SPE cartridge, it's actually important to, calculate absolute recovery to understand the actual performance of the SPE device itself. So what we're going to look at here specifically is, if you can imagine the test tube or the cartridge on the left, we're taking our sample, we are spiking in a known concentration of our analyte, and we are passing it through the SPE cartridge, performing SPE. Now, in order to make that matrix match standard that I was discussing, or otherwise referred to as a reference, we will simply basically create a blank sample, not spiking in the sample, the analyte before SPE, and instead we do it after. And it's the same concentration that we pre-spiked at. So by assessing the peak area between these two things, this absolute recovery, we can tell, how efficient our extraction was. So an easier way of probably describing this is just the peak area response of the sample divided by the reference times 100. Something else that we could look at is also calculating matrix effect. So in the same way that I just described creating that matrix match standard, we're going to compare the response from that matrix match standard to a neat standard. Ultimately, what this results in, if you solve this math problem, is that if we have anything less than a 100% value, this means that we have some type of matrix suppression or matrix effect. Anything greater than 100, and we're looking at an enhancement basically, but ultimately, I think these two things, matrix effect is not the end game here. It's kind of how this thing works in combination with, with the recovery values that you're getting. It's possible to create a matrix match standard that's very clean. However, if you're losing your analyte along the way, that added signal that you're getting from reducing the matrix effect doesn't exactly do you a whole lot of good. So this is a look for just further look at matrix effect. So what's not stated here is this is, if you're an LCMS chemist, you know what this is. This is just post-column infusion. And what I mean by that is we are continuously injecting our analyte of interest into the mass spec, bypassing the LC column and the auto sampler. Now, what happens at the same time that we're infusing this analyte into the mass spec is that we are injecting an example blank matrix that goes to the auto sampler, through the column, and then into the system. So since we are continuously infusing the analyte into the mass spec, we are able to see this kind of continuous trace as opposed to a peak. This will allow us to find any regions of suppression that are, caused by the blank matrix. On the right, we're seeing this suppression zone at the very end. It actually correlates to a phospholipid elution. So you're seeing basically they're competing for ionization, reducing our sensitivity at this particular retention time. So something that you need to take into consideration for method development. On the left, by contrast, we have ion enhancement. It's a little bit difficult to see, but we have two different traces here. We have a orange trace and a green trace. We're effectively comparing. This was pulled from one of the, experiments that I did, looking at cleanliness of different extracting solvents. And so you'll notice that the green solvent is much more constant. It's actually more in line with what the system blank looks like, whereas about 2.5 minutes, you see that the orange trace provides a significant amount of signal enhancement. So again, ion enhancement, ion suppression, I think that post-column infusion is a very good way of assessing general matrix effect on a sample if you happen to be doing LCMS analysis. Okay, so we're going to move into pre-treatment now. This is actually very important. And this is pulled from one of our brochures. Ultimately, I think what kind of the take-home is for me is that, each matrix is different and is going to require a different type of pre-treatment. That being said, it's also not that simple because the type of analyte that you're analyzing has a lot to do with what pre-treatment you end up choosing. So, for example, I guess I'll start on the bottom and kind of work my way up since I have more specific examples to give you for some of the biological samples. But for fruit and vegetables, I mean, most people typically do this via catcher's extraction, the quick, easy, cheap, effective, rugged, safe, which to describe it is using like a salt-assisted liquid extraction. For fruits and vegetables, it's important to homogenize, and then typically in the presence of some type of either, if there's not enough water in the sample, to add water, and then in the catcher's protocol, you would add, acetonitrile and then, a salt to get actually partitioning. So organic solvent or aqueous-based phase, depending on what you're trying to actually extract out of the sample. Then there are creams and ointments, depending on whether or not they're oil-based or water-based, is going to determine whether or not we should dissolve and homogenize in hexane, for example, versus doing the same thing in water or even potentially like a water-soluble organic like methanol. So soil and sludge, a lot of filtering. You can even do this via soxolate. I've seen people do this via catcher's extraction as well. So again, I guess what's important when you have these sort of particulate-laden solid samples, it's important that you appropriately pre-treat them if you're going to load them onto an SPE cartridge after the fact so that you're not clogging the cartridge itself. So to kind of skip up to the biological samples of interest, we typically talk a lot about plasma, we talk a lot about urine, we talk a lot about whole blood, also think about them a lot. Plasma in general, and I'll show an example of this after the fact, but it's very important, depending on the type of compound you're working with, to disrupt any protein-analyte interactions. The general rule of thumb, like kind of the bare minimum for doing something like this, is adding like 2% phosphoric acid. And then as it gets more complicated, or as the analytes become effectively more sticky, we have to increase this disrupting factor, whether or not it's by including organic solvent, zinc sulfate. All these things can definitely help disrupt protein-analyte interaction for plasma samples, and I'll again show an example after this. Urine samples, keep in mind that there are more than just the parent compounds found in urine samples, so we have lots of glucuronidated metabolites. So we need to find a way to cleave these off. So this is usually performed, well, historically, via base hydrolysis, acid hydrolysis, or I guess now sort of the gold standard is with enzyme hydrolysis, so with a beta-glucuronidase, for example. And then just to kind of wrap things up on this slide, whole blood is also important to pre-treat effectively in that it is different from the previously mentioned biological matrices in that we have to lyse the red blood cells, right? So we can do this either via chemical lysis, whether it's zinc sulfate or with a portion of water and simply performing an osmotic breakdown, typically coupled with some type of physical denaturing. What can be difficult with preparing large amounts of whole blood samples if you're adding 1 ml of whole blood to an equal part of zinc sulfate, and then following that up with a acetonitrile protein precipitation, the volume starts getting pretty large and becomes difficult to handle in a high throughput environment. So again, keeping in mind that all of these pretreatments that we're going to do to these samples, we have to be aware of what our downstream analysis is going to look like. How is adding 2 parts acetonitrile to my blood sample going to affect my retention on a reverse phase SPE cartridge? Poorly, to answer that question. But anyways, so just things to think about. I probably talked for too long on that slide. But anyways, moving forward, again, pretreatment is important. This is a plasma example, and specifically for 25-hydroxy vitamin D2, D3. So what we're looking at here is the protocol below. So it's the same. We're basically screening different SLV solvents and pretreatments. So SLV is supported liquid extraction, also behaves by the same mechanism as a liquid-liquid extraction. So what is compared here is a dilution of the plasma with a content of organic solvent versus 2% phosphoric acid. So if you'll look down at the bottom using the same SLE method, the recovery is night and day difference between the organic dilution versus the acidic dilution. So again, we're showing 90% recovery versus 12% recovery, indicating that the vitamin D is actually still bound to the protein and that we are not able to recover it via an SLV extraction. So again, this is just a good case in point to show you that in this case, phosphoric acid is not enough to disrupt that protein-aniline interaction. Urinary hydrolysis, to show you the workflow here very quickly. This is like a presentation in and of itself, but we have our urine sample that we'll use, and we're going to perform a hydrolysis on it, right? We want to cleave off these sugar groups and create a homogeneous mixture of compounds that we can then analyze via LC or GC. I have a Strata logo on this collection plate that this workflow is historically done on. So we add it to our collection plate. We incubate it, which is the fire, which induces the cleaving of glucuronide groups, and we have our parent compounds. The reason why I had Strata mentioned on what was conceivably just a collection plate is that we have improved the workflow for this such that you are able to do the SPE plate historically is now used in lieu of the collection, I guess in addition as the collection plate. So you can take your SPE plate, perform the hydrolysis within the SPE plate, and then simply filter and perform solid phase extraction. On the left, we're talking about beta-glucuronidase removal. This is a little bit quicker approach than just full-blown SPE. So this product serves as a collection plate and then simply as a filtration device to remove the beta-glucuronidase, whereas with the SPE, we would filter, wash, and elute. So a few more steps with SPE, a little bit cleaner, but again, 2 options for products that contain SPE media that can also be used as a collection plate. Okay, there you go, in-well hydrolysis solutions. Okay, this is something that I wanted to mention since we're still talking about pretreatment. I think maybe based on the fact of how much I've been talking about pretreatment, it leads me to my kind of dumb, I guess, comparison that I feel like sample prep in general is kind of like painting a room in the sense that you spend more time putting down the cloths, taping up the walls, making sure that you don't get paint everywhere. You spend a lot more time doing that than you do actually painting, and that's kind of the same thing with solid phase extraction and just sample prep. Getting everything ready is what takes a lot longer than the 30 to 45 minutes that you actually spend doing the, the actual chemical extraction. So this pretreatment, for example, we're looking at, I'm working on this right now. we're trying to extract, it's actually carboxy THC from hair. The reason why sample pretreatment is important is because the concentration of carboxy THC found in hair is thousands of times lower than what you would find for other drugs of abuse. The part that I'm getting to for troubleshooting this method, typically what you'll do for a hair method following like a NIST publication is 20 milligrams of hair with 1 mil of 1 normal sodium hydroxide, incubating for 1 hour at 75 degrees C. So that's the first picture on the left is what we have. And then in the middle, we'll actually add our HCl to this to neutralize it. This actually crashes out some of the pigments, which makes our sample cleaner. What you're seeing on the right, you get this pellet at the bottom, which is kind of, again, the pigments and some of the fatty acids that sort of crash out of solution. The problem with this approach prior to an SLV type of example is that the carboxy THC actually crashes out as well. So still doing a little bit of method development on it. We were able to show that it was crashing out. We decanted off that yellowish layer and then back extracted the pellet with ethyl acetate hexane to find that that's where we lost the carboxy THC. So anyway, this is still in work and not complete because I had to get on the road prior to this conversation. But if anything, Matt, what's your point? Sample prep can be cumbersome, at least the pre-treatment part of it, even before we get to the SPE device, if we so choose, that's what we're going to do. So again, just keep in mind that there are other elements to this than just the on and off SPE that I'm going to discuss moving forward. So intro to SPE. SPE is the most selective form of sample prep in that it specifically targets analytes of interest. Something like liquid-liquid, for example, you're only really targeting certain classes of compounds, whereas with SPE, we have the ability to target tertiary amines over primary amines over secondary amines. We have a decent amount of selectivity in terms of discrimination between different analytes in a matrix. So that really is what makes it the gold standard for sample prep. In general, we have 5 steps with SPE, 5 to 6 steps, depending on kind of how you're doing it. Typically, you are going to prime the cartridge. You're going to be conditioning it with some type of organic solvent, followed by an equilibration with a weaker solvent, and then we're going to be loading our sample, washing away the impurities, and then eluting our analyte back off the cartridge. So a lot quicker, concise way of stating that is catch and release, right? So we're going to catch our analyte of interest, wash away what we don't want, and then elute off our analyte of interest. Another way to do this is also to use an SPE device as a chemical filter. With that said, traditional SPE, this whole process is usually followed up by a dry down and reconstitution in mobile phase. This is usually the step in the process that gives you that 10x concentration. And hopefully, if you did your process right, this SPE step was very helpful because drying down and reconstituting some type of aqueous phase can take you a very, very long time. If you're really interested in bypassing the dry down and reconstitution step altogether, there is a micro-elution format SPE, which effectively uses miniature SPE, so very, very small frits, very, very small sorbent bed mass, which allows you to elute off with such a small amount of organic solvent that you don't have to dry down and reconstitute to achieve that 10x concentration that you would have to do via traditional SPE. Also very popular for compounds that can be thermally labile or ones that are very hydrophobic and don't like to reconstitute back into solution after you dry them down. Peptides are something that I'm thinking about when I'm saying that. So in general, there are many advantages of SPE over something like a liquid-liquid extraction, typically more reproducible, more friendly in a production environment, really get a better concentration of analytes as a function of just performing the technique itself, no more cleaning glassware, so on and so forth, again, leading to increased productivity, the ability to batch process samples. Having a cleaner sample will also lead to less instrument downtime and better data analysis, better chromatography. Limitation of SPE is that it's pretty bad at separating a very similar compounds in the sense that if you can't separate them on an HPLC column, you cannot separate them on an SPE device. You might be able to play around with some type of miscibility issue, but for the most part, if you can't can't separate it on an LC column, you pretty much can't separate it on an SPE device. Okay. So separation modes now. This is just kind of a quick look at the chemistry at play for the SPE devices that hopefully you will be doing method development on. Reverse phase interaction, van der Waals forces, relatively weak in the scheme of things, to be honest with you, but basically kind of like attracts like in this case. So we have these this hydrophobic interaction between these more so bulky constituents of some of our analytes of interest. In reverse phase, like it is with chromatography and SPE, for example, weak solvent is water. Strong solvent, in this case, very, very strong solvent would be hexane. A more reasonable solvent to use for reverse phase would probably be like methanol, acetonitrile, for example. In typical phases used are C18 and phenyl. So it is the most popular mechanism for which we sell solid phase extraction. The reverse phase SPE market is still the biggest. Not to say that it is necessarily the best, but has a wide variety of applications in terms of, environmentals, drugs of abuse, DMPK, aqueous extracts is kind of where it is king. So by contrast, the next thing we have is a normal phase interaction. So the forces at play here are actually hydrogen bonding or dipole-dipole interactions. These interactions are actually substantially stronger than the van der Waals forces discussed previously. And the solvent scheme is flipped here. So we're talking about a weak solvent being hexane, strong solvent being water. In most cases, if you're performing normal phase, if you're choosing between normal phase and reverse phase, it is the sample matrix that determines the separation mode. So if I'm working with an oil-based matrix, for example, my oil-based matrix is really only going to be miscible in hexane, which means I'm going to be doing normal phase and normal phase extraction. So sample matrix will determine separation mode when deciding or we're choosing between normal phase and reverse phase SPE. So this is really popular a lot of times in the environmental industry. You see even I guess pesticide cleanup as well. Fractionation of hydrocarbons. The EPH method is something that comes to mind here. PCBs and transformer oil, to name one or two. Showing you now again that the whole solvent scheme is flipped. Not super important to the conversation right at this second, but you'll notice that this is done relative. The elutropic strength, that's actually a word, is done relative to silica, in this particular case showing that hexane is the weakest solvent and acetic acid, polarized water, is the strongest, right? Polarized water to disrupt those polar interactions. That makes sense, right? Okay, so ion exchange. I'm going to be talking a lot about ion exchange SPE today, and specifically stated that I think it is the best form of SPE. It is the strongest interaction. It's actually a Coulombic force attraction, so substantially more, it requires substantially more energy to break this bond than it does for a weaker reverse phase or even dipole-dipole interaction. The reason why this is important for SPE is because SPE is on and off. And so if we have this very, very strong retention mechanism to capture our analytes of interest, that means that we will get better recovery first and foremost, and that we're able to wash with a even stronger solvent, typically 100% organic, which is going to clean our sample up better, going to give us better matrix effect and better recovery. So in addition to the data analysis portion, you're also going to get better column lifetime. You're going to get less instrument maintenance required. So in general, ion exchange is kind of the gold standard of gold standards. As opposed to like attracting like, it's opposites attract in this world. So in this particular example, we're showing on top it's a sulfonic acid group, and then on the bottom it's a carboxylic acid group. So we have attracting a charged primary amine and then a quaternary amine as well. So we want to pair. I'll get into that in the next slide. But opposites attract in this particular case. Very common for drugs of abuse industry, pharmaceutical, for biological fluids, and even cleanup of any sort of like medicinal chemistry reactions that you could imagine. spoiled the surprise in that we're again showing you that there is an increased amount of energy required to break these types of bonds for the Coulombic attraction in green. Again, substantially more than like the dipole-dipole interaction and hydrogen bonding that takes place with other forms. It says here that ion exchange kinetics are slower than reverse phase and normal phase. That might actually be true, but because of how much stronger the interaction is, I actually believe that it happens a little bit quicker. These things will actually just really kind of the best word to describe it is to just like suck onto the sorbent chemistry very quickly. So typically things like conditioning for polymeric media is less critical for ion exchange resins than it is for reverse phase resins, just because that ion exchange interaction kind of overcomes any deficiencies in sort of sample prep technique. What's important to mention for ion exchange interaction is that typically we want to pair strong and weak together. And what do I mean specifically by that? So strong sorbent functionality, one that is permanently charged, always we want to pair that with so for example, we have, I guess 2 over from the left, we have a strong cation exchange resin. We would pair that with a weak base. We wouldn't ever want to pair a strong cation exchange sorbent resin with a permanently charged amine, for example, because there is no pH that we can adjust to disrupt that interaction and effectively, I guess, remove our analyte of interest back off of there. That is why there are weak cation exchange resin, which is the chemistry to the left of that, to the far left. It's a carboxylic acid. This phase is actually, you're able to neutralize the phase itself. So if you're working with an analyte that is permanently charged, you can just simply adjust the pH to neutralize your phase, which may be a lot easier than taking the pH of your sample to 15, for example, right? So in any case, that you have with the weak cation exchange resin or weak anion exchange resin, you have the added flexibility to neutralize the sorbent itself, which is also something that you need to take into consideration when loading your sample, in that when you are loading your sample onto an SPE device, a weak anion or cation exchange, you want to be at the appropriate pH so that your sorbent is actually charged. So again, just sort of something to think about there. And then sort of combining combining reverse phase and ion exchange, we get this mixed mode interaction. So effectively, this is very popular for people performing large panels of analytes, in particular, hydrophobic analytes, and then maybe ones that are polar basic analytes. You're able to use the hydrophobic retention of the polymer-based media, or potentially a grafted C8 on the surface to extract hydrophobic non-ionizable compounds, and then extract polar bases with the ion exchange resin. So this is a very all polymeric media is considered to be mixed mode by definition. So to talk about the media itself, again, I guess I'm going to kind of go through this a little bit quickly, but silica-based phase are the historical, I guess, kind of, the original SPE. It is prone to pH modification, unfortunately, so effective workable range is around 2 to 9. And really, in general, I think that the silica-based SPE phases are staying in the market more specifically because of the normal phase applications, and less to do with the performance of the C18E or C8 that's shown here in particular. They are rigid, they are inexpensive, and they are easy to chemically modify. So there are definitely applications for them. But just to be, I guess, the most popular uses for silica-based phases these days are, specifically for ones performing normal phase applications. So this is a newer technology, polymeric-based SPE. I've already kind of talked about it a couple of times. I mentioned that it is a mixed mode interaction. So you have these multiple modes of interaction is what I actually mean to say by that. Hydrophobic interaction, hydrogen bonding, and then pi-pi interactions. Having multiple modes of interaction is helpful for more strongly retaining our compounds, which means that we can be more aggressive with our washes. And that whole thing about getting a cleaner sample, giving you higher recovery, all is in the same breath of this polymer-based SPE. So it's also deconditioning resistant, to be honest with you, you don't have to condition it if you don't want to. We always recommend it, and I would argue that you will always get better results if you do. But if you really hate that conditioning and equilibrating step, especially if you're running like mass spec, for example, it really doesn't make much of a difference, at least in terms of what you're going to see in your chromatogram. So that is one thing. Has a higher loading capacity, about 10 to 15% of the sorbent bed mass is a general loading capacity, whereas silica has a lower surface area. It's about 5%. And all of our polymer materials are a styrene divinyl benzene that are then effectively bonded with whether it's an ion exchange resin or additional hydrogen bonding and vinyl pyrrolidone ligand. So to give you an idea, just to show you the chemistry of what's going on, I know I mentioned multiple modes of interaction. You'll see here we have the styrene divinyl benzene backbone, and then we're getting a significant amount of hydrogen bonding from the N-vinyl pyrrolidone that's functionalized to the surface, and then even pi-pi stacking. So again, multiple modes of interaction for strata X, and then these are all of the different flavors that we offer. So everything from strong cation exchange resin in the top left, and then down below we have a weak cation exchange, and then strong anion exchange, and then weak anion exchange below that. So again, depending on what types of analytes you're looking at, this will kind of determine which sorbent you're going to end up choosing. Okay, so that is the background. I know this has been kind of a lot, but method development. So I think that you have to be ready in doing method development. You have to be ready to get involved with all of the chemistry of your analyte in particular. So that's really the first thing that I like to do, is just really making sure that we know exactly what the structure of the analytes are that we're interested in characterizing. And then kind of following this, is there anything ionizable, and then knowing your sample matrix. So in this particular step, we're going to be considering the analytes of interest. I think that at a certain point, we don't need to concern ourselves with each and every carbonyl, each and every ether group, all of the different hydroxyl groups we have on there. I think having a general understanding for how hydrophobic is the analyte, and kind of is there anything ionizable that we can really make use of. So just kind of, I guess, sort of familiarizing yourself with the different features of the compound that you're looking at is important, since we're going to be specifically extracting it. In that I guess, general phrasing, I would say that for the log P value, or measure of the hydrophobicity of the compound, is very important. And even more so important is the log D value. So the log D value is a pH-specific function of log P. And so again, what you're seeing here, we're looking at atenolol. And so atenolol is the third compound down here from at the bottom. And so you're looking at, what we're looking at with this this XY is how hydrophobic the analyte is, the log D value. The higher the number, the more sticky it is, relative to the pH of the sample. So with atenolol in particular, it's a basic compound, and so we know that in order to neutralize basic compounds, we want to add base to the solution. By doing that, we're actually seeing that at pH between 10 and 12, it's substantially more hydrophobic, it's more sticky in the neutralized form. However, when we add acid, those hydrides in solution bind up nicely with our secondary amine. They effectively turn our analyte into a positively charged species, which again reduces the hydrophobicity, makes it extremely more, much more polar than than what we have at a higher pH. So manipulating the pH for ionizable compounds is very important with respect to understanding SPE in general. And oh, not that button. And here's just a further look to show you the different ionized states of the compound across a different pH spectrum for atenolol. And then how that is, I get kind of in my mind, I think like inversely proportional to the log D of the compound. So the next step, is there anything ionizable? This is almost kind of step one for me, and I think specifically because if you didn't kind of read between the lines, that I think ion exchange SPE is the best kind of SPE. if there is something ionizable on our compound, we definitely want to try to make use of it and then implement an ion exchange SPE. So again, we're going to have to familiarize ourselves with the pKa of the ionizable structures and then try to figure out which ion exchange resin we can use. If for some reason we don't have something that's ionizable, then we're going to be left either performing a reverse phase application or a normal phase application. So it's either going to be, this relates back to what I said before, in that if your sample matrix will determine the separation mode. So again, if we have a water immiscible sample, we're probably going to be doing some type of normal phase, and if we have a water miscible sample, we're probably going to opt for more of a reverse phase approach. To a certain extent, the analyte characteristics, this is just of the SPE mechanism and the actual sorbent itself. So I would just say if we're stuck in the middle, if our sample matrix is a water immiscible sorbent and we're looking at normal phase extraction, it's at this point that I would really familiarize myself with the things I said weren't so important up front. So, one too many. So in this particular case, if we're doing normal phase, I would really familiarize myself with how many hydrophilic groups do I have, how many carbonyl groups do I have, and that's ultimately why I would just say that if you can avoid normal phase, you should. But anyway, so again, this is just basics for looking at how to determine what type of SPE that you're going to choose. Silica-based sample, so this is determining, if we know which chemistry we're picking, the next step is to determine what size cartridge do we need. This is kind of like an empirically determined chart. It is a little bit conservative in my particular opinion, but can give you an idea specifically of based on how much blood, serum, plasma, urine, filtered tissue homogenates, water, soil extracts you're working with, what size cartridge you should start with. This relates back to the surface area of the silica-based particles as well. And then again, for polymer, it's going to have a higher surface area in comparison to the silica-based material. So based on how much blood, serum, or plasma we're using, that's going to determine which size sorbent bed mass we're going to choose. So we're going to go over a specific example for this in a little bit, so don't worry if it went too quickly. So what we recommend too, and I think it can be difficult to actually do this, is collecting your fractions. So if you're losing recovery of your analyte, admittedly it must be going somewhere, whether it's coming through in the load fraction in particular. This will tell us specifically, based on where we find it, this will tell us how we need to modify our method. And if we're losing it in the load fraction, maybe we overloaded the sorbent, maybe we picked the wrong phase, maybe the pH was incorrect, or maybe the sample solvent was too strong. If we lose it in the wash solvent, maybe the wash solvent was too strong. And if we don't find it anywhere, it's possible that it's still stuck on the sorbent, so maybe we need to increase the amount or the strength of our eluting solvent. I think it's important, if you're going to be very effective at performing SPE method development, that you understand your solvents and kind of know what you're working with. Right here on the left, it's showing increasing elutropic strength as a function of moving down for reverse phase SPE. So again, methanol being weak, and then working our way all the way up to hexane. While we do consider hexane to be the strongest solvent for reverse phase, it's also not a whole lot of things are miscible in hexane. So stronger is not necessarily better. There are a couple of good binary solvent schemes that can be very helpful for whether it's elution or wash steps, for example. Acetonitrile and IPA is a really very strong mixture for reverse phase interaction. You have a relatively strong aprotic solvent in acetonitrile, and then a relatively strong protic solvent for in IPA. So these two things together kind of function as a very, very good cleanup step for plasma samples, or as a good elution solvent for for just a traditional reverse phase SPE. Acetonitrile and methanol kind of behaves by the same ideology as the acetonitrile and IPA, except the methanol is a little bit weaker than IPA, so it's typically a little bit weaker relative to the solvent mixture mentioned above. And mixtures of ethyl acetate and hexane. I'm a big fan of supported liquid extraction, and this is my favorite solvent mixture, and I just wanted to let you all know that. So in any case, if it's important, and I guess I'll just not belabor the point too much, but if something went wrong, please be critical of your general steps. It's a very hands-on technique, at least from like a method development perspective. So please be very critical of yourself. Maybe accept the idea that you did something wrong. I know it's difficult to come to terms with. I try to tell myself not to second guess myself, so I'm kind of being a hypocrite. But anyways, you need to definitely evaluate each step of the process to make sure that you did everything correctly. Did you let the sorbent dry out? Were your flow rates too fast? Is it the right sorbent? Am I using the correct wash solvents, etc.? Okay, so in this case study, I'm going to talk about all of the different steps and sort of why they are important. The example, as I mentioned before, is for methylphenidate or Ritalin. It's shown down here below. So we're going to ask, what is the sample matrix? What is the analyte and properties? From this, we're going to ask, is there anything ionizable that we can make use of? And yes, I see an amine group with a pKa value of about 9 that we can definitely use for ion exchange. And then knowing what the sample volume is also important for determining what size cartridge you're going to be using. So we have this lovely like choose your own adventure guide. It's present in our catalog. It's also in a couple of technical notes on the website. But in following this decision-making tree, you can understand which phase to pick and ultimately working you up to like a starting SPE method. So again, aqueous-based sample, this means, remember, it's plasma. This means we're going to be doing reverse phase or ion exchange. We know that we have something ionizable, so we are going to do ion exchange. Based on the fact that we're working with 200 microliters of plasma, this means that we're going to be using a 30 milligram cartridge. And then from this, we can actually determine how much solvent we need to wash with. So as a general rule of thumb, we indicate that we recommend washing and eluting with 8 bed volumes of solvent. So you can extrapolate out how much a bed volume is based on this chart as well, just to understand, what's my dead volume in an SPE cartridge, which might be a question you have later or something. So, but 8 bed volumes is what we consider to be sufficient for, fully wetting and eluting off analytes of interest. 4 bed volumes would be the practical minimum. So based on this logic, we have come up with using a strong cation exchange resin for our weekly basic compound. So again, you could probably jump ahead pretty quick if you just recognize those 2 things, but again, to just kind of go through the process, you could do this with just about any small molecule you want. In terms of pretreatment, because we're doing ion exchange, we want to make sure that we are ionizing our compound of interest before, so that we get some sort of ionic interaction with our compound. This is a look at the pKa values. Again, the pKa of our compound is 9, so we want to be 2 units below that in order to ionize it so that it sticks to our strong cation exchange resin. So what we're going to recommend for general sample pretreatment for ion exchange then is just going to be to dilute in some kind of acid. There are many purposes to performing sample pretreatment. Oh my God, we're talking about it again, sample pretreatment, why won't he stop? And I will now. I'm just going to go to the next slide. So, sorry, that was bad. The main purpose really, I guess at the very least, is to dilute our sample up. If we're working with like plasma, for example, we want to homogenize the viscosity of the samples between different wells so that we get more of an even flowing sample. That's important for patient samples. Also, by diluting our sample, it's going to increase the amount of time that our sample spends interacting with the SPE chemistry in particular. So with that said, we're going to basically just maximize interactions, hopefully get better recovery. And then, to be honest with you, we'll also have this pH adjustment that takes place as well, as I mentioned, like diluting in some type of acid for an ion exchange resin. There can be other things like that were under discussion previously, like disrupt protein binding by maybe adding a little bit of organic content or zinc sulfate, maybe hydrolyzing compounds. So again, we're starting to repeat ourselves, aren't we, precious? Okay, so the first step is going to be conditioning. So this is particularly critical for silica-based resins. So flow rate isn't particularly important, but we want to make sure that we are properly orienting the ligands of interest. So especially for silica-based reverse phases like C18, we want to make sure that we're conditioning with some type of organic solvent, whether it's methanol, acetonitrile, IPA. And then most often, common practice for conditioning solvent is to condition with what you elute with. You don't want to be eluting off your analyte of interest and have that be the first time that you've shown the cartridge a strong solvent. So it's better to flush out any of the junk from the cartridge, whether it's plasticizers, so on and so forth, with the conditioning step, and not flush them out when you're trying to collect your analyte. So good common practice is to condition with what you elute with. Next step would be equilibrating. If we're doing a reverse phase example, which we're not, but if we were doing reverse phase example, we would want to make sure to flush out all, well, not all, but most of the organic so that we have somewhat acceptable conditions for actually retaining our compounds. If we're performing reverse phase SPE, for example, if we load in high organic, we're not going to get any retention. Because we're doing ion exchange, we don't actually have to do this particular step. I find it helpful and just kind of reassuring, to be honest with you, but remember that ion exchange interaction is so much stronger than reverse phase interaction that we could actually just condition and load our sample on if we wanted to, and really probably not see too much of an ill effect from doing so. General rule of thumb here is to match the initial sample diluent. So if we're diluting in formic acid, we should be equilibrating with formic acid. Next, we're going to load our sample onto the SPE device. So slow is safe is the general rule here. Yeah, there it is. So 1 to 2 mils per minute. What is that? It's like 1 or 2 drops per second if you can actually see your sample eluting off. So there are 2 parts of the SPE process that are so critical for flow rate, and that is loading the sample onto the cartridge and then eluting the sample back off. So please just, slow is safe. Maybe even start with like a pulse and then let it flow by gravity until you're comfortable with knowing how fast you can push it. But again, we're catching the analytes of interest in this particular case. After we've caught our analytes, we're going to be washing away the interferences. I always like developing my SPE methods with 2 wash steps where I kind of refer to it as like a sandwich, if you will. So remember that I mentioned that we want to match the equilibration buffer with what we dilute our sample in. So let's say that's still, for this particular method, formic acid. I think that the first wash step should always be formic acid immediately after that. So again, I think it's kind of a sandwich because all 3 steps are just a sample that's diluted in the same solvent. So we have, I guess, formic acid in the equilibration, formic acid in the dilution, and then formic acid in the first wash. If for some reason you're working with a plasma sample and you don't have, if there's one well in your 96 well plate that doesn't go all the way through the SPE cartridge because it's really viscous or something, and you go to add your first wash step, which is 100% organic, you're going to crash the proteins out and clog the well. So it's just kind of a good way to be safe about making sure that your sample is fully loaded onto the SPE sorbent itself. And again, for this particular example, because it's ion exchange, we can be as aggressive as we want to, so long as we don't change the pH, and we're going to implement that acetonitrile IPA mixture that I mentioned before. Drying can also be very important. I guess the whole function of performing a dry step, after your wash step, you're kind of preparing for elution. And what you want to do for this dry step is really just remove the residual wash solvent. You don't want to dilute your elution solvent, as a function of you don't want to dilute it, right? You want to actually elute off with what you're expecting to elute off with. What's worse than not drying is drying for an inconsistent period of time. So I always recommend sitting there with a stopwatch and measuring out, is it 5 minutes, is it 10 minutes, just being consistent about it, because a differential amount of drying is going to give you a differential amount of dilution of your final buffer, which could possibly give you irreproducible results. So be super, super consistent about your drying step. And then finally, eluting off your analyte of interest. If you were listening before, be as slow as possible in this particular case. And general rule of thumb is to break your elution volume up into 2 aliquots. So with the Choose Your Own Adventure SPE 123 guide that we went through to decide on this particular method, we want to take that same volume of solvent that we identified for a 30 milligram or 50 milligram cartridge being 600 microliters, and we just want to break it up into 2 aliquots. So 2 by 300, not 2 by 600, but 2 by 300, and then actually applying a little bit of vacuum in between each elution step to kind of dry the cartridge out completely. We just want to basically make sure that it's kind of related to Le Chatelier's principle of extraction, and that no extraction is ever going to be 100% efficient. So we want to make sure that we flush this with 2 different aliquots. There we go. So the next part, so ion exchange methodology. This is the whole, everything kind of full circle now. So 200 microliters of plasma, 200 microliters of formic acid. Remember, we want to ionize our compound of interest. And then this is the full method. So we're conditioning with the strength of the elution solvent. So we have this methanol acetonitrile mix. We don't have to add the basic modifier here if we don't want to. You totally can. But just make sure that the pH is the same between equilibration, load, and wash, and the wash step. So again, we're kind of sandwiching on here. That IPA acetonitrile is really good for removing, any, I guess, more hydrophobic analytes and junk that we don't want from the plasma matrix. And admittedly, I keep pressing the arrow button instead of that one. So this is what the recovery for this method. This is actually something I've worked on from the ground up, and spiked at 3 different concentrations. Just ran on the LCMS and seeing that matrix effect looks really good, recovery looks really good, and the standard deviation looks very good at the low end. So, okay, this is the last part, and this is really kind of, this is what would happen if you didn't decide and listen and go with the ion exchange method. Because methylphenidate is hydrophobic enough, we can actually do this via reverse phase interaction, and hopefully I'll show you here that, like, it's not, you can get there and the method might even be as good, but, like, man, it's going to take you a lot more time. So this is my general, I kind of had just like a gut shot. I was like, all right, well, let's do this. And I did this just for this presentation actually, but that's kind of embarrassing, right? So we have, I said, well, let's do this via reverse phase. Let's see what happens. I'm going to just kind of guesstimate that based on the log p-value being 2, that we can probably wash with about 30% methanol and not lose any of our analyte of interest. So I did that, and then I eluted off with 0.1% formic acid and methanol. Remember, the log D value, which I think is hopefully the next slide. So this is the recovery: 68%, 4% RSD, 57% matrix effect. Not super clean, not the best recovery, really not my best effort, to be honest with you. But again, excluding the ion exchange portion of this, we can just follow this being an aqueous phase sample. We know that it's at least somewhat hydrophobic, and we can do reverse phase interaction. We have 200 microliters of plasma, which means that we would use a 30 or 50 milligram cartridge, also leading us to 600 microliter wash and elution steps, giving us either C18 or Strata X. I chose Strata X. In this particular case, we're going the opposite way with this example, in that we're not going to want to dilute an acid. We want to neutralize our compound to make it as hydrophobic as possible. So we're going to dilute it in ammonium hydroxide. So in this particular case, we're going to follow the method exactly as it was before, except we're going to get to this wash step, and then this is the difficult part about reverse phase SPE, and we really need to pick a wash solvent that is strong enough that it washes away the interferences, but not too strong that it elutes off our analytes of interest. So we have to do, unfortunately, you can just guess and get like mediocre recovery like I did, or you can do this, which is just hopefully horrifying to you. No, I'm just kidding. It's really not that bad, but it's a wash and elution design experiment. And we went through all the different things. So you basically follow the method up until the wash step, and then you try, and I would recommend doing this with neat standards first, not in matrix, but assessing the recovery that you get, treating these like an elution solvent, and then seeing what you get for 0% all the way up to 100%. And this is what we got, actually. So I looked at 2 different solvents. So keep in mind we did conditioning with methanol, equilibrating with the ammonium hydroxide. we loaded our sample on, we washed with ammonium hydroxide, and then we washed with 600 microliters of ... And looking back at all of those different little scintillation vials that I filled up, what was really interesting is that we'll start with on the right. So on the right, we have the response versus percentage of methanol. You'll notice that this particular trend identifies that at about 60% methanol, you see that we get zero recovery, which means that this is the kind of the last little even part on this little XY. And this indicates that this is really the best wash solvent that we could put forward. And then ultimately, we need about 100% methanol to get it back off of the cartridge, which identifies as a good elution solvent. Now, if we add formic acid to the methanol elution, you'll notice that we get a much more premature elution of the compounds off of the sorbent. So what is most interesting about this, aside from the fact that the 0% methanol takes about 4 hours to dry down, so I recommend using like as small of a sample as possible, that ultimately this identifies that what my mind is thinking here is that, well, we can wash with 60% methanol and then we can actually elute off with 50% methanol so long as we have a 0.1% formic acid modification. You see a little dip around 60% at the graph on the left, and that was just kind of a bad injection on the mass spec, so don't read too much into that. But in general, I think the final part of the method, which I never would have thought of before, was that, oh my God, we can do a reverse phase method, and because, remember, our compound is ionizable, we can wash with 60% methanol, and then we can elute off with 50% methanol with that formic acid modifier, which is going to give us a really clean sample. So I think that, again, part of the drawback here is that we're eluting with 50% aqueous, which means that dry down time is really going to suck. So again, it's kind of what's important to you, but at the same time, by eluting off with only 50% methanol, we're going to bring a lot less of the junk back off of the cartridge that we would have otherwise brought off if we would have just eluted with 100% methanol in formic acid, aka the 50-ish% matrix effect that I showed from the previous slide. So anyway, I'm really happy I got to share that with you because, again, the dry down time took so long, and I just wanted to tell you all about how long that took. But what you got to do for reverse phase SPE is your own business. So thank you so much for listening, and I guess that's it for the presentation. Back to you, Steve.